Rheumatoid arthritis is commonly considered a chronic disease in modern medicine. Disease-modifying drugs, DMARDs, biologicals, and other medications help to reduce pain and discomfort, but often the suffering continues in varying levels. Also, if the medications are stopped, the pain and discomforts return. As a result, medication that reduce our immune system activity, which have many side effects, have to be taken lifelong. Here we will learn about a patient who for the last 16 years, since 2008, was on steroids and medications like methotrexate, tofacitinib, etc., but continued to suffer from pain and discomforts and developed joint fixity and deformities, was able to come out of discomforts and medications. Here we see how this patient was able to overcome the discomforts, how long it took to get relief from symptoms, how long it took for multiple medicines to be reduced and tapered off, and progress evaluation based on corresponding improvements in periodic tests. This series is about my experience with the patients who took clinically supported lifestyle correction to avoid surgery and taper off medications. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on undergoing surgical procedures or continuing with the lifelong medication. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with the lifestyle modulation, etc., you may search our YouTube healthcare channel. When we come to the details of the patient, this is a 56-year-old male, height 182 centimeters, weight 66.5 kg. His problem is arthritis, joint pain and stiffness, and sometimes edema and redness also come. And it started, the medications have started from 2008 onwards. He has developed some deformity on the toes also, and some thickening of that is cones and callus formation inside the sole also. And when you come to the family history, his mother is also having arthritis. When the diagnosis, initial diagnosis is arthritis, rheumatoid arthritis, because he was on a treatment with the rheumatologist, and the diagnosis is already there. When we come to the more details, about the patient, as I said, the symptoms is mainly focused on the joint stiffness, redness, and deformity, and stiffness also. Then, when we come to the medications, he was on taking methotrexate. When we actually, before starting treatment, we do a detailed blood test and body composition analysis and all. And he was on medicines, the methotrexate, that is an anti-metabolite type of medicine. It is mainly, initially it was using for the cancer treatment, and now it is very commonly used for the rheumatoid arthritis and psoriatic arthritis, psoriasis, etc. And tofacitinib, that is a newer generation medicine, comes under the biologicals actually. It is a protein inhibitor. He's taking that also. Deflazacort, it is a steroid medication. He's on that. And folic acid, calcium and vitamin D, that is to support other nutrition and all. Next, when we come to the blood test, actually he is not taking any medication for the dyslipidemia, but his cholesterol level was high. Vitamin D level is very low, only 14. And HSCRP, that's an inflammatory marker, that is high. That is actually blood vessel inflammation. It's a cardiac risk factor actually. And ESR also high. Because CRP and other things are battery low because he's on the anti-inflammatory medicine. His anti-CCP is high. His rheumatoid factor is normal only, but anti-CCP is high. It's more than 200. And anti-TPO, that is a autoimmune marker of the thyroid gland. Usually Hashimoto's thyroiditis. And that is also started increasing. Usually a patient with rheumatoid arthritis, the chance of getting other autoimmune diseases like thyroiditis is very common. Or even the thyroid patient, I have seen many patients, They started with the thyroid actually. Initially, after 10 or 15 years after getting Hashimoto thyroiditis, they will be taking levothyroxine and all. But gradually, this rheumatoid arthritis or fibromyalgia and all starts. And also his tin level, it's toxic elements also we look into, and tin level was very high, 11, almost 12, 11.93. When we look into his body parameters, his normal weight only, his BMI is only 20. We see patients in all three categories, that is overweight or obese patient, and also those with a normal weight, and also underweight patients in the rheumatoid arthritis. And his BP was slightly on the normal range, and he has, even though his weight is okay, he has some abdominal obesity, some protruding tummy is there, and fat percentage was very high. I mean, normally healthy, it will be 10 to 15% only should be the fat level in gents, but his almost 30% is fat, and the muscle is muscle and the bone is very weak. The muscle mass is low. Then when we come to the final diagnosis, he's actually the prostate ultrasound scan showed prostate enlargement also. So the rheumatoid arthritis is there, and with the deformities of the foot, and with the callus and cone development in the soles, and benign prostatic hyperplasia of grade 1. When we come to the disease category, it is an autoimmune disease, and also there is a benign tumor of the prostate. Usually at this age, it is very common after 40 men is having prostatic hyperplasia. That is because prostatic hyperplasia starts with an hormonal derailment, and this autoimmune disease patients, the chance of getting prostate cancer and other cancers also very high, because but his PSA was normal only. Next, when we come to the clinically supported lifestyle correction, what we are trying to do with the clinically supported lifestyle correction, to find out what are the problems with him by a detailed blood test and all. And another thing about the blood test is also very important. Actually, his body was reacting to, this immune system is reacting to many common food like lady's finger, potato, lemon, and also many pulses, many of the pulses like green peas and orange, cashew nut, milk, egg, etc. If the body is reacting to some food items also we have to avoid, and also the toxins inside the food, that is colors and preservatives, that's food additives and cosmetic also should be reduced. So what we are trying to do is, in the clinically supported lifestyle correction, give optimal nutrition, optimal exercise, and also reduce the toxin getting through into the body through food, water, air, etc. And if there is toxins deposited in the body, to eliminate that. He has excess fat in his body, and also toxin 10 level was high also. So trying to reduce that. Then what was the result? What were the changes with the clinically supported lifestyle correction? When we come to the symptoms, actually his main symptom was the joint pain and stiffness. And by the 8th day itself, he is almost 40% reduction in the symptomatic relief was there. And the 15th day, it again came down to 50%, then 30 days by 65%, and day 60, it is 80% is over. And by the day 90, he was totally symptom-free. And meanwhile, we are reducing the medication also. Actually, on the day 1, his medication was, he's taking the 15 milligram methotrexate, and by the first week, because he was so symptomatic, we didn't reduce any medicine. And the 8th day onwards, we started reducing. Then this methotrexate, usually if it is 15 milligram, then make it 10 milligram, then 5 milligram, 2.5 milligram, then make it in a alternate. It's weekly. If it is taking, it will be made in alternate, and then they taper off. And for him, the methotrexate was tapered off by 60th day. The methotrexate was over, and tafasitamab was over by 30th day itself. Initially, it is after 8th day, it is alternate day, and the 15th day, it is stopped after that. And deflazacort, that is steroid also, initially first week continued the same, and then the second week alternate days, third week stopped. And folic acid and calcium and vitamin D, that is also continued, because vitamin D we have other this actually he was taking very low vitamin D only, but his vitamin D level was very low, so he was given slightly higher dose of vitamin D. And when we come to the blood report, actually in the initial blood test his dyslipidemia was there, that was come down to 50. By the 15th day it was corrected, cholesterol level came down, vitamin D was corrected by it was only 14 initially and 53 by day 30. And HSCRP by the 8th day itself, his inflammatory marker and cardiac marker was come down to normal, ESR came down, and TPO, that is autoimmune antibody for the marker of the thyroid autoimmune marker, that came down by 30th day itself. That anti-CP, that is a specific marker for the rheumatoid arthritis, was this lab was not giving the exact value. It is showing that more than 200. In the 30th day it was more than 200, and in the 60th day also it was more than 200. We don't know the exact value. Maybe it was reducing, but by the 90th day it came down to 69. So that is clearly that autoimmune activity itself is reduced. Not only the symptomatic relief, medicine was, he's able to get symptomatic relief without medicines now, and this even the autoimmune markers and the inflammatory markers are all come down to normal. And the tin level, that is one of the toxic element, that is a heavy metal which was so high in his body, that also came down to normal. Next, when we look into the ultrasound scan report, actually after the 90 days we repeat an ultrasound scan of the abdomen. And initially he had a benign prostatic hyperplasia, and by the 90 days his abdominal scan became normal. Usually if it is some obese patient or even overweight is there, we usually see this fatty liver also. Usually if the patient is continuing everything correctly, that fatty liver also will be gone. For him there was no fatty liver initially, only there was a benign prostatic hyperplasia. By 90 days the ultrasound scan became normal and the prostate size reduced also. Next is what was the changes happened in his body actually. That is, we checked the body parameters also. Actually his weight, he was not overweight, he was only 66.5, but by the 90th day he is reduced to 58.7, 59 kg. And but the fat level, his fat level was initially 29.6, almost 30%. It has come down to 22%. And his BP was, even though he was not taking BP medicine, his BP was high, but it was also came down to normal 120/70 only by the 90th day. And even abdominal obesity, his abdominal circumference of 88 centimeters came down to 72. So all the body parameters are came to the almost optimal level, but we always want to increase the muscle and bone mass. It has come down to 58.7, but what we want is any further, that is the initial 3 months. Then next 3 months what we are trying to do is to increase his weight to 60 to 65 kg by improving the muscle mass and bone mass. The fat mass should further should go down to ideally to less than 10 to 15%, at least below 20%. That is what we are aiming. And actually, he's because he is thin. The body age was showing only 46 initially itself, but after 3 months, his body age came down to 33 actually. So even the body age and even when we look into this patient, there was no cardiac problem, so we didn't look into the CIMT and blood vessel aging. But even the blood vessel aging and calcification and all will be reduced. So actually, it is actually correcting the body parameters. So that every parameters will be get an improvement with the clinically supported lifestyle correction, because here we are not directing to the symptomatic relief. We are actually correcting the body and allowing the body to rebuild into a healthy, with the healthy cells. Next, when we look into what was the difference the patient got with the clinically supported lifestyle correction. Actually, when we symptom-wise, when we started, he was on so many medicines, but he is symptomatic and he was in pain and discomfort and the stiffness of joint and so many problems. But with the after the treatment, he was actually, his problems, the joint stiffness, edema, everything is gone. The deformity part was not completely gone, but it is reduced, because once the deformity, some level of improvement we can bring. That is especially what we are saying, the leg is not, many people it is not big problem, but for the hand, if the fingers are not functioning, it is very difficult. Even they will not be able to hold things, and even I have seen patients who's having difficulty in eating also. But those things also will improve. Some extent, not all the fixity can be. Once the fixity is occurred, only some level of improvement, and the improvement will, for after, if the patient is continuing with all the instructions, and then definitely that gradually the improvements, it will not, we cannot expect within 30 days or 90 days the whole the deformities can be reversed, but there will be tremendous improvement will be there. But it the completion, it may not be possible, or at least it will take more time. Next, before starting, he was on so many medicines, 5 or 6 medicines, and after, by that 60 days itself, not even 90 days, by 60 days itself, he is free from medication. And when we look into the blood parameters, even the the inflammatory markers, the autoimmune markers like anti-CCP, TPO, and everything was many things, only that abnormal and significant on this patient is I'm mentioning. And it was everything which is abnormal was came down to normal except the anti-CCP. Anti-CCP was more than 2200 and it came down to 69 by day 90. If the things are going fine, definitely it will come down, maybe normal, but only some patients it may not come to this fast to normal. They will be symptom free, but the anti-CCP and this even RA factor can be high also, but usually, but this patient anyway, I think by next month he will be getting it corrected. And the tin level, he had a very high level of tin in his body, and it is also came down to normal by the day 30. Day 90. We usually this heavy metal and all will only after 3 months we check into. When we come to the ultrasound scan before and after the treatment, he had benign prostatic hyperplasia initially, but after 90 days that is also prostate size is reduced and there was no prostatic hyperplasia. When we come to the body parameters changes, his weight was reduced from 66.5 to 58.7 and BMI 20 to 18, and BP from 140/80 to 120/80. And abdominal circumference was 88 centimeters and came down to 72. And body age, it was initially 46 and came down to 33 actually. So even the body age can be reduced. You can become much younger also. And fat percentage was around 29.6. It came down to 22.1. But in the future, what is our plan is actually this initially our plan is to, initial focus is to make the patient symptom free, make the patient medicine free, then to build up his body for because he is suffering from so many years the rheumatoid arthritis. His muscle and bone has become weak, and now we want to build up his muscle and bone, and now next is to try to increase his weight to around 60 to 64 kg, not by increasing the fat content but by increasing the muscle and bone mass. Next, when we compare this clinically supported lifestyle correction and the conventional treatment with medication or the surgeries for this rheumatoid arthritis, what was the patient's gain with this? So if you are continuing with the conventional treatment with methotrexate, tofuralimab and all, even now also he is symptomatic, he may have to go for more advanced or more costly biological sort of medication, like this latest generation medications like TNF inhibitors. So many, every 1 or 2 months, new biological medications are coming for the rheumatoid arthritis and all. So he maybe have to go for other medicine to take to symptom free. And also if some medications, because if he continue with the steroids and all, he may gain weight, and now itself is slightly hypertension is started, and maybe he can develop diabetes, hypertension and even obesity. Even dyslipidemia is already there, and they can get other diseases like heart problems and all, because his cardiac marker is also high. So he will be needing for future more medicine, maybe more surgeries for the comorbidities if he gets. And the immunity will be always compromised when they are on medication like methotrexate, tofascilamine, and steroids. So if the patient gets into some other complications, like if there happen an accident or a wound or an infection like COVID or a pneumonia or anything, then this patient, because he's already having a disease and on steroids and immunosuppressants, this will be a complex patient. Complex patient means any patient who's having other diseases will get exaggerated, and the current or the infection or injury, it will be very difficult to heal. That is a situation of a patient. When they get any other problem, they will become the complex patient, and the recovery will be very difficult or more complicated. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by plant exercise. Third, minimizing toxin entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. comes under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from the government service and in 1997 started practicing as consultant at Lifecare Center, Thevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medication we take are excreted in the urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medications. To protect our children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patient on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning surgery for lifestyle diseases. Thank you.